If someone asked you right now, is your heart truly healthy and strong? You probably couldn't answer with complete confidence. That's because heart disease, like many health problems, usually doesn't develop overnight. It can silently progress for years without obvious symptoms. And one of the biggest challenges is that many people don't realize something is wrong until the condition has already become serious. The good news is that your heart often gives important clues about how well it's functioning. By paying attention to these signals, you can get a general idea of your heart health. In today's video, we'll look at 5 practical signs that are commonly associated with a strong, healthy, and well-functioning heart. Let's get started. Sign number 1, a regular heartbeat. First, sit down and relax. Place 2 fingers of your right hand on the inside of your left wrist and try to feel your pulse. If you can't find it right away, move your fingers slightly until you detect the rhythm. Once you feel your pulse, pay attention to the pattern. Does it beat regularly, like the ticking of a clock? Does it suddenly speed up or slow down? Does it feel like a beat is occasionally skipped? One important characteristic of a healthy heart is a stable electrical system. Most people think the heart simply pumps blood, but it also has its own electrical network that controls every heartbeat. If your pulse feels steady and rhythmic, that's generally a positive sign. However, if you frequently notice an irregular heartbeat, especially if you're over age 50, it's a good idea to discuss it with your healthcare provider. Keep in mind that occasional skipped beats can happen even in healthy people. Stress, lack of sleep, and excessive caffeine intake can sometimes trigger them. Sign number 2, ability to handle mild physical activity. Now, stand up. Walk briskly for 1 minute. There's no need to run, just walk a little faster than your normal pace. After 1 minute, stop and ask yourself, can you still speak comfortably? Do you feel any pressure or discomfort in your chest? Are you so short of breath that talking becomes difficult? A healthy heart can usually handle light physical activity. If you can still talk normally and feel no chest discomfort after a minute of brisk walking, that's generally a good sign. However, if mild activity causes significant shortness of breath, chest heaviness, or noticeably reduced stamina compared to before, it deserves attention. In particular, unusual breathlessness while climbing stairs can sometimes be an early warning sign of a heart-related problem. Sign number 3, check for unusual swelling in your legs. Now, sit down again. Press firmly with your finger on the front of your lower leg, the shin area, for about 5 seconds. Then, remove your finger and observe the spot. Does the skin return to its normal shape immediately, or does a dent remain for a while? If the skin quickly returns to its normal shape, that's usually a reassuring sign. If a noticeable indentation remains for some time, it may suggest fluid retention. When the heart becomes weaker, it may not pump blood as efficiently, allowing fluid to accumulate in the lower parts of the body and causing swelling in the legs or ankles. Of course, leg swelling can also occur for other reasons, such as long periods of sitting, travel, or eating too much salt. But if your feet or legs regularly become swollen, especially later in the day, it's worth discussing with a healthcare professional. Sign number 4, healthy blood pressure levels. If you have a digital blood pressure monitor at home, sit quietly for 5 minutes. Then take 2 blood pressure readings and calculate the average. In general, a systolic blood pressure around 110 to 120 millimeters mercury and a diastolic pressure around 70 to 80 millimeters mercury are considered healthy for many adults. These numbers often suggest that your blood vessels remain relatively flexible and healthy. However, if your readings are consistently 140 over 90 millimeters mercury or higher, it may indicate high blood pressure and an increased cardiovascular risk. Don't panic if a single reading is higher or lower than normal. What matters most is the pattern over time. Sign number 5, your waist to height ratio. This is a simple but surprisingly useful test. Measure your waist circumference using a measuring tape. Then measure your height. Now, divide your waist measurement by your height. If the result is less than 0.5, it generally suggests better metabolic health. If it's greater than 0.5, there may be increased likelihood of excess visceral fat. Visceral fat is the type of fat that accumulates around internal organs. This fat can promote inflammation, contribute to insulin resistance, and significantly increase the risk of heart disease. That's why waist size, not just weight alone, is an important indicator of heart health. Final thoughts. If most of these 5 signs are positive for you, it's reasonable to think that your heart is currently functioning fairly well. However, a healthy heart today doesn't guarantee a healthy heart tomorrow. Maintaining good heart health requires consistent habits over time. Keep your cholesterol under control. Monitor your blood sugar levels. Avoid smoking completely. Get enough quality sleep. Manage stress whenever possible. Stay physically active and exercise regularly. Be especially vigilant if heart disease runs in your family. Now, we'd love to hear from you. Which of these 5 signs surprised you the most or seemed the most important? And don't forget to tell us your age and where you're watching from in the comments below. Stay informed, stay healthy, and start taking care of your heart today. Medical disclaimer. This content is for educational purposes only and is not intended to diagnose, treat, or replace professional medical advice. If you have symptoms or concerns about your heart health, consult a qualified healthcare professional.